welcome everybody for this webinar. And the first part of this webinar, I'm going to speak about some facts and figures about CAUTI. If we look at the USA, right, UTIs are the most common hospital-acquired infections. In fact, 80% of these are due to an indwelling catheter. And also, an indwelling catheter carries a daily risk of CAUTI acquisition of 3 to 7%. 12 to 16% of adult inpatients will have a catheter during their stay as well. And the National Health Safety Network, in 2011, the CAUTI rates for adult inpatients were between 0.2 and 4.8 per 1,000 catheter days. We also know that catheter-associated urinary tract infection is reported to be the most common healthcare-associated infection worldwide. And also, it is estimated that 69% of CAUTI events are avoidable. Also, CAUTIs lead to longer length of stay of hospital stays in healthcare as well. And also, it is the leading cause of secondary bloodstream infection or bacteremia. And also, we have that using antibiotics to treat UTIs without symptoms, unfortunately, would contribute to more the problem of antimicrobial resistance. Also, there are studies that have found a strong correlation between catheter use greater than 6 days and also the development of CAUTI. When we speak about mortality rate, it decreases to approximately 10% when the patient also has a secondary bacteremia, which means a bloodstream infection as a result of the UTI. Also, CAUTI is the most common adverse event associated with indwelling urinary catheter use. Now, what we know about the European countries, this is a slide by the ECDC, and every 5 years, the ECDC, they do a point prevalence study, which is quite a robust study. And here we're seeing that, first of all, 6.5%, the healthcare-associated infections accounts for 6.5% approximately across Europe. Although CAUTI is not common as in the US, but still, as you can see in this slide, it's one of the top 3 when it comes to healthcare-associated infections. And also, from the same slide, almost half of all UTIs are in urology wards, as you can see. And 71% are CAUTI, which is very similar to the US. In 2007, Ireland, they did a study on healthcare-associated infections and antimicrobial use in long-term care facilities. And the survey looked at the following: healthcare-associated infection, antibiotic use, infection prevention and control resources and practices, and antibiotic resistance. What is interesting that from this HALT study, healthcare-associated infection in residents with a urinary catheter was double compared with residents without a catheter. Also, residents with a urinary catheter had 14.1% antimicrobial use, and 17.3% of all these had a healthcare-associated infection. The HALT study, 2016 analysis, showed that urinary catheter use to be the only significant risk factor for both antimicrobial use and healthcare-associated infections. And here we're seeing urinary catheter use in the European Union countries and even in the EEA countries. And we have a wide variation here. It starts from a 5%, next please, a 5%, and goes up to 35%. And this shows, as I said, a wide variation, beginning from Lithuania, which is the least, 5%, and the most being used, urinary catheter use, is Greece, followed by Cyprus, Italy, and the Czech Republic. And now I would like to pass the floor to my colleague, Laura Ross. Before I end up, this is very important, but because in 1958, although it's a bit old, Dr. Paul Beeson warned that the decision to use this instrument should be made with the knowledge that involves the risk of producing a serious disease, which is often difficult to treat. And I think I have to say that this advice remains relevant today.